Welcome back. Well, today I am joined by Dr. Moleji, who is here from Kaiser Permanente. Well, doctor, so nice to meet you. Thank you for joining us.
Thank you for having me. I'm really glad to be here to share some facts and figures about the seasonal influenza.
Yeah, well, we've all been talking a lot about it, and of course, we also have COVID-19 to worry about. So at least this is one thing we can take care of. So it's one less thing to worry about. So let's kind of jump right in now. When is the most appropriate time to get the flu shot? Should I start right now?
Yeah, now that it's October, it's definitely the right time. Most experts you see will suggest waiting until October to get it. That way, you still have coverage for the tail end of the flu season, which sometimes can leak into April or May sometimes. So at this point now, I'd say if you come anywhere near a flu shot and you haven't had it, get it now.
Yeah, it would seem that just about every place I go, they've got flu shots for free, or, do you want to get your flu shot now? So if you are a member of Kaiser Permanente, what are some things that they should be looking into to get that flu shot?
Great question. So pretty much all of our office buildings, whether you're coming in for an appointment for something entirely different, let's say you're coming in to see your dermatologist for your annual skin screening, or you have a follow-up with another doctor, all of our buildings carry the influenza vaccine. So whether you're coming in even for just a simple lab test or medication refill, you don't need appointments for it. We have usually a table with the nurse that their sole responsibility is to provide that flu shot. So all you need to show them is your Kaiser card and they'll take care of you.
Okay, excellent. Now, the vaccination is effective. I mean, it has been effective. However, there have been a lot of, I think, doubts as how effective it really is. Can you give us a kind of a background on that?
Of course, yeah, that's one of the biggest points of contention when patients are hesitant or not certain whether they want to get it because they've read something in the news about the vaccine's effectiveness was only 29% this year or 39%, and the thought is, well, shouldn't we have 100% effective vaccine before we distribute to the public? And what I'll say is, you can look at the data a lot of different ways, but the way that number is actually calculated is simply based on, they're looking back from the year when patients actually come in and get swabbed for influenza and it's detected on the swab, and then they say, well, did that patient get a shot or not? It has no, investigation into the severity of that patient's disease. A lot of young kids will just carry flu in their nose and they don't have symptoms, but they'll count against the effectiveness of it. What matters to us as clinicians, healthcare providers, is effectiveness in the way that we measure, does it prevent a person from coming to the hospital, getting really sick? And of course, the worst complication of flu being death. And we know from other data that the flu shot is highly effective at doing that. And that's really where we want patients to focus their attention on effectiveness, not just focusing on that one number, which is a very small segment of assessing effectiveness.
So let's take a look at the slide that we're showing now, impact. So of course, we have this discussion on a regular basis because of COVID-19, is that unfortunately, many people have died because of the COVID-19. And if we didn't have a vaccine at all for the flu, we would be looking at a lot higher numbers.
Absolutely. With influenza, a lot of times it doesn't get enough attention because we've dealt with it for so long. So it just kind of gets put into the background. But we've had influenza vaccines for decades, and that's reduced mortality significantly, reduced hospitalization significantly. Of course, we also have tried and true therapeutics for it also. So we see that influenza kind of takes a backseat to other infections in terms of the publicity behind it. But by and large, we know that our number one fight and tool against influenza every year is the shot.
Okay.
All the other treatments are supportive, but we know influenza vaccination can have a profound impact on reducing hospitalization and death.
Well, good point for sure. And then, let's talk about, the safety of the flu vaccine. I mean, I know some people say, well, if I get it, I'm going to get the flu.
Mm-hmm. Yeah, probably the most common concern I've heard. I got that shot last year and I got the flu from it. So number one, you cannot get influenza from the vaccine. There is no active viral component in that shot. So I want to rest that or put that concern to rest. You cannot get the flu from the flu shot. Now, people say, but I felt a little bit down. I felt a little bit fatigued. And I say, well, that's just your immune system waking up to create antibodies and create protection. That's not you getting the flu. That's your immune system doing the job that it was designed to do. And you want it to do that against this vaccine, as opposed to the real influenza, which can be a lot worse. So I tell people, you know what, I hear what you're saying. You had some effects. You had, a little bit of malaise, what we call that weakness feeling, a little bit of fatigue. Those are common side effects to any vaccine, but they're far better than getting the flu, which could have a whole host of other effects affecting your organs, sometimes even permanently.
Well, and especially now where we're still susceptible to COVID-19, especially the folks here that live in our village is, there are many that are 65 and over, and getting the flu shot would probably, would you agree, allow their immune system to help be healthy?
Absolutely. There's still so much ongoing research about how an influenza vaccine, even outside of influenza, may provide protection against other diseases because of what it does for your immune system. It wakes it up to know that something is around and it's prepped. Now, no one is going to claim that the influenza vaccine exactly prevents COVID, but we know that there have been cases of patients who have both influenza and coronavirus. And when you have two viral infections at once, if you've already got protection against one, you've already given your body a head start. And that's really where it's important. So if you're, that unlucky person who got exposed to both, then if you've had protection against one, you've already given your immune system the head start that it needs.
That's great. Now, when we look at the next one about fighting the flu, it looks very common. I mean, I think I've been looking at a chart like this for the last 6 months.
Yes, yes. Prior to COVID, these were things that we would talk about kind of on the wayside. Now we know that in daily life, masks are everywhere, and social distancing, washing your hands, the 20 to 30 seconds, warm water, soap, or alternatively, a hand sanitizer with at least 60% alcohol. These are things that have just been ingrained into our mind. And it's good because we know those simple measures are the best way to prevent getting exposed to the virus. So that's one arm of prevention. The other arm is the vaccination. When you combine those two together, the good hygiene practices and a vaccine, you've put yourself in a really powerful position for prevention.
That's great. I mean, like you said, if we can do anything to help our bodies with the immune system to help fight it off, I mean, our chances are much better, like you said. Misconceptions. I guess there's still a few out there.
Oh yeah, yeah. There are. I think you already nailed one of them, which is I can get the flu from the flu shot. So that one hopefully is put to rest in your mind. But the other ones are that, I've heard everything from the gamut. They're injecting something into my body to watch me, or, that it doesn't work, or that someone's making money off of it. And I will tell you, like, no one is making money off of a flu shot. This is a public service initiative to keep not only yourself healthy, but your loved ones healthy. You're protecting the people around you as well, because there is a category of people who we call asymptomatic carriers. And you may have heard of this even with COVID. It exists with influenza too. And the vaccine is known to reduce the risk of that too. So even if you're that lucky person who doesn't get any symptoms, you could be passing it on to a dear loved one. So the flu shot helps prevent that as well. So you don't become a jumping point for this virus to infect someone you love and care about. So
you had mentioned earlier that some people carry the virus in their nose, but they never have any symptoms. So is that considered the asymptomatic?
exactly. And to your point about that, when people come in here maybe for a little runny nose, sometimes at other urgent cares or hospitals, they'll just get swabbed on a routine and we detect the virus. And then they say, oh, the vaccine was ineffective because they were carrying it but didn't have symptoms. So that's, once again, on that effectiveness point, we always want to keep in mind the effectiveness really we measure more accurately when we talk about what's the end result to patients, what's the end result to our healthcare system. Are we actually taking care of patients for complications of this disease?
All right. Well, thank you so much for being with us. I really appreciate it.
Thank you for having me and allowing us to share this valuable information.
All right. You have a good day.
You as well. Thanks so much. Bye-bye.
All right. And we'll be right back after this.